And welcome back. The questions are still coming in about COVID-19 and the state's response. We're continuing our live conversation with Dr. Benjamin Chan via Skype to answer your questions. And Susan asks, what is the criteria for determining a COVID-19 death? A lot of people keep claiming that every death is currently being called COVID-19 related.
Yeah, so we rely on a healthcare provider's assessment regarding whether or not a death may be COVID-19 related. So anybody who dies in the state gets a death certificate filled out, and that's most often done by a healthcare provider who's assessing a patient. Sometimes it's done by the medical examiner, but we rely on these death certificates to help inform whether someone who passed away may have died from a COVID-related complication.
Okay, Tara asks, has or can the virus mutate at all?
That's a great question, and many different types of viruses over time as they spread can undergo genetic changes, what we call mutations. So whether a virus mutates significantly or enough to, for example, make a vaccine less effective, as we see every year with influenza, that is still being studied and investigated. And so there are studies ongoing currently to look at how this COVID-19 virus may change over time.
So Deb asks, we keep hearing what the symptoms of the virus are, but if you feel like you might have the virus, is there a way to curb or to try to halt the progression or the severity at the beginning stages of the virus?
So most people that have that become infected with this novel coronavirus that causes COVID-19 will only have mild symptoms. Oftentimes there'll be cold-like symptoms or mild flu-like symptoms. Not everybody has a fever. There is no current medical treatment or pharmaceutical treatment which we know or is recommended to treat early symptoms or halt progression of COVID-19. So unfortunately for right now, it's supportive care, making sure someone is, well rested, getting adequate hydration, potentially taking, acetaminophen if they have a fever to reduce symptoms of COVID-19. But there are not any currently approved direct medical therapies. Again, something that's undergoing investigation and study.
And another puzzle from Karen. She asks, if someone carries the virus and is asymptomatic, how long do they carry the virus, and how long can they continue to spread it if they never show symptoms?
Excellent question. There is guidance and criteria coming out of the Centers for Disease Control and Prevention about all these types of situations, both if someone is symptomatic with infection and if people are asymptomatic but are tested and diagnosed. This, in most people who have a normal functioning immune system, we believe that someone can potentially be infectious for up to a week, possibly longer, 10 days. It's hard to say. Everybody is a little bit different, and it does partly depend on whether someone has symptoms. So if someone is diagnosed and tested with COVID-19, I suggest they talk to their healthcare provider about how long they need to be on home isolation for. It's going to be on the order likely of 7 to 10 days, depending upon their particular situation.
And Dr. Chan, Michelle asked, was this virus here in February? UNH was hit hard. Many of my closest friends had a terrible flu and all tested negative for flu. If you go out to a public place, you find that it doesn't help to take a shower as soon as you get home.
Yes, so this question about was the virus here in February? We started monitoring and doing testing, certainly in January, February, and certainly into March when we identified our first case. From all the testing we did early on, which was on the more limited side, but from the testing that we did, we were not finding a lot of infection early on. Testing was available. We were trying to identify people that might be at risk and test, but we did not identify broad infection at that point. So we think it's unlikely that the virus was circulating widely in New Hampshire back in February.
All right, Dr. Chan, great questions, great answers. We'll have more with you when we come right back.